We are just lifting the V1 division. Okay. What you are seeing is this V1. Now we are reflecting the V1 along with the ganglion. Okay. So now when this is lifted, what you see here is this is the sixth nerve. Okay. This is the sixth nerve. So the abducent nerve enters through the Doral's canal. Okay. This is called as the Doral's canal. So this is actually a canal, or this is made as a canal by the petrosphenoid ligament. This is also called as Gruber's ligament. Okay, this is also called as Gruber's ligament. This is actually between, this is the petrous apex, and here you have the lower part of the dorsum sella. So this ligament connects the lower part of the dorsum sella with the petrous apex, and thus this foramen is converted to a canal. Okay, this opening is converted into a canal. This is actually an opening between the lower part of the dorsum sella and the petrous apex, and this is made as a canal by the petrosphenoid ligament, also called as the Gruber's ligament. And this you see is an infralateral trunk which passes anterior or passes above the sixth nerve, abducent nerve. So we have seen two ligaments. One is the petrosphenoid ligament, the other is the petrolingual ligament, which covers the exit of the petrous carotid at the level of carotid canal. So now what is being done is, so now what you see here is the anterior clinoid process, and medial to the anterior clinoid process, what you see is the internal carotid artery. Okay. So this anterior clinoid process is now drilled. Okay, so now the anterior clinoid process is now drilled. So here what you see is the upper dural ring, and here what you see is the lower ring. So upper dural ring and then the lower dural ring. So these dural rings are formed by the dural reflection. That part of the dural reflection which runs above the anterior clinoid process forms the upper ring. The one which runs below the anterior clinoid process forms the lower ring. So thus the upper ring and the lower ring. This is also called as the proximal dural ring. The lower ring is called as the proximal dural ring, and the upper ring is called as the distal dural ring. So this forms the carotid collar. So here is the internal carotid artery. This dural rings form the carotid collar in the that is surrounding the ICE. So then once the ACP, that is anterior clinoid process, is drilled, what you see is the optic strut, and then the clinoid part of the ICA. This is the clinoid segment of the ICA, and this is the optic strut. The optic strut is a structure which separates the optic canal from the superior orbital fissure. So here is the optic nerve. So this is the optic nerve which enters the optic canal, and here is the superior orbital fissure. So this optic canal and the superior orbital fissure is separated by this optic strut. So I will show you in the, this is clear, the upper dural ring, the lower dural ring, the optic strut which separates the optic canal and the superior orbital fissure, and what you see is the clinoidal segment of ICA. So this structure you are seeing after drilling the ACP, anterior clinoid process. So now what you see here is the boundaries of the cavernous sinus. So again you see the trigonal impression. This is the petrolingual ligament. So this marks the lower boundary of the cavernous sinus. And the second ligament which we have seen, that is the petrosphenoid ligament or the Gruber's ligament. So this is the sixth nerve, and this is the infralateral trunk from the carotid which runs above the sixth nerve. And this is the optic strut which separates the optic canal from the superior orbital fissure. This structure is obtained by the drilling of the anterior clinoid process, and what you see here is the clinoidal internal carotid, clinoidal segment of the internal carotid.